You've probably heard it 1,000 times. It's just normal when you get older. Your doctor says it, your friends say it, maybe even your kids are saying it to you now. But here's what nobody's telling you. Constipation after 50 is not normal. It's not something you have to accept. And what's worse, most seniors are making 3 critical mistakes that make it worse, mistakes that are completely avoidable. Today, I'm Dr. Alex Mandell, and I've spent 25 years watching seniors regain their independence, their energy, and their confidence by understanding one simple truth about their digestive health. In the next 20 minutes, I'm going to show you exactly what's happening to your body and, more importantly, what you can do about it starting today. Before we dive in, I want to ask you, have you noticed yourself struggling more than you used to? Maybe it's been harder to keep up with your grandkids, or you're worried about embarrassing situations when you're out with family. That heaviness, that bloating, that feeling like something just isn't right. I hear about it every single day from people just like you. What you're experiencing isn't laziness. It isn't weakness. It's your body telling you something important. And the good news, it's completely treatable. But before we go any further, if you find this information helpful, please take just 2 seconds right now to like this video, subscribe to the channel, and click the notification bell. That way, you'll never miss a video that could change your life. Now let's get started. Let me tell you about one of my patients. I'll call her Margaret. She was 67 when she first came to see me. She sat down in my office, and the first thing she said was, "Doctor, I think I'm just getting old." Margaret had been struggling with constipation for almost 2 years. She went from someone who could hike with her family to someone who didn't want to travel. Why? Because she was terrified about what would happen if she wasn't near a bathroom. That fear, that loss of independence was stealing her life. Margaret's struggle wasn't unusual. In fact, nearly 25% of seniors age 65 plus experience chronic constipation, but most don't talk about it. They suffer in silence. They change their lives around it. They think it's just what getting older means. Here's the truth nobody explains. Your digestive system changes after 50, but not the way most people think. Most of your friends will blame it on diet. Some doctors blame it on lack of exercise. Your family probably suggests more fiber, but here's what's really happening. And what happened next with Margaret is going to surprise you. As you age, 3 things happen to your digestive system. First, your muscles, including the muscles in your colon, naturally become weaker. This isn't weakness like you think of it. Your colon still works, but it works slower. The muscles that push food through your system aren't as strong as they used to be. Second, your nervous system ages. Your body produces less of a chemical messenger called acetylcholine. Without enough of this, your colon's nerve signals get slower. Again, not broken, just slower. Third, you're likely taking medications you weren't taking 10 years ago. Some of these, even the ones that help with other things, slow down your digestion. More on that in a moment. These changes mean your colon needs more support, not less. Most people do the opposite. They restrict their lives around it instead of fixing it. Now, what happened with Margaret was that she discovered something that changed everything. Margaret came back to see me 6 weeks later. I barely recognized her. She walked in with color in her face, with energy I hadn't seen before. She said, "Doctor, I went hiking with my family last weekend. For the first time in 2 years, I didn't think about a single bathroom." What changed? Not her age, not her basic health. She made 3 specific changes, and they work because they address the actual problem, not just the symptoms. But before I tell you what those are, let me ask you something. Have you ever felt like nobody, not even your doctor, takes constipation seriously? Like it's somehow embarrassing to talk about? Most seniors feel exactly that way, and that feeling of isolation, that's often making the problem worse. If this is resonating with you, please share this video with someone you care about who's dealing with the same thing. They need to hear this. Like if you're ready to change your life, let me introduce you to another patient. His name was Robert, and he was 72 when he came to me. Robert thought he had everything figured out. He was eating what he thought was a healthy diet. He was drinking water. He was doing the right things, or so he thought. Robert was making mistake number 1. Adding more fiber without addressing why your colon is struggling. Many seniors add fiber in the wrong way, at the wrong time, or without drinking enough water. The result? More bloating, more discomfort, and more frustration. As Robert told me, I started eating more vegetables. I added fiber supplements, but instead of getting better, I felt bloated all the time. His daughter noticed it too. She said, "Dad, you seem uncomfortable after meals now. You didn't used to be like this." Here's why this happens. If your colon is already slow, adding fiber without addressing the underlying problem is like putting more cars on a crowded highway with no exit ramps. You're just creating a backup. The right approach? Start differently. way differently. Now let me tell you about Susan. Susan was 58 and she was making mistake number 2. Susan's biggest problem wasn't what she was eating, it was what she wasn't thinking about. She was stressed. Her husband had recently passed away and she was managing her grandchildren's schedules, her own health, and her aging mother. Her life was chaos. Constipation after 50 is heavily affected by stress, irregular sleep, and disrupted daily routines. Many seniors don't realize that emotional stress literally changes how your digestive system works. What happened next surprised even Susan's family. Her doctor suggested she work on stress management. Within 2 weeks of adding a short meditation practice and keeping consistent meal times, her digestion improved dramatically, not overnight, but steadily. Why? Because your gut has its own nervous system. Scientists call it the second brain. And when you're stressed, your second brain shuts down digestion. That's not a character flaw, that's biology. Mistake number 3 revealed in 7 to 8:30. The third mistake, this one surprised me when I realized how many of my patients were making it. Mistake number 3 is assuming that because a medication helps with one thing, it won't hurt your digestion. But here's what many doctors don't tell their patients. Certain medications, things you might be taking right now, directly slow down your gut. Mistake number 3, medication awareness. Common medications that can slow digestion, blood pressure medications, certain pain relievers, some antidepressants, and iron supplements. But do not stop taking any medication without talking to your doctor. We need to address this together. I had a patient, David, who was on 3 medications. One of them, a pain medication he took for arthritis, was significantly slowing his digestion. When we worked with his doctor to adjust his regimen, his constipation improved without changing anything else. Now, here's the important part. I'm not telling you to stop your medications. Never do that without your doctor. But you should have a conversation with your healthcare provider about whether your medications might be contributing to your constipation. Many doctors don't bring this up unless you ask. We're halfway through understanding your digestive health. If this is helping, please subscribe now and share with someone who needs to hear this. So what did work for Margaret? What changed her life? It came down to 4 specific pillars. And here's the thing. Once you understand these, everything else falls into place. I need to be honest with you. Most seniors are dehydrated, not dramatically, but chronically. And this is a major contributor to constipation. Why? Because constipation isn't just about movement. It's about moisture. Your colon needs water to make stool soft enough to move. Without enough hydration, everything gets dry and stuck. Here's what happened with Margaret. She was only drinking about 3 glasses of water a day. She didn't think she needed more. She didn't feel thirsty. That's common in seniors. Your thirst mechanism becomes less sensitive as you age. We increased her water intake to about 8 to 10 glasses a day, but here's how we did it, and this is important for your independence. We spread it throughout the day. Morning water with breakfast, a glass mid-morning, water at lunch, afternoon hydration, and then we stopped by 7 p.m. so she wouldn't be running to the bathroom all night. 8 to 10 glasses daily, spread throughout the day. Stop by 7 p.m. to avoid nighttime bathroom trips. Start with increasing gradually if you're not used to it. Monitor your urine. Pale yellow means you're well hydrated. One more thing, certain drinks make dehydration worse. Caffeine and alcohol are both diuretics. They pull water from your body. Limiting these can actually help your hydration improve. Now, I can hear you thinking, do I have to start running marathons, doctor? No, absolutely not. In fact, that could actually make things worse. I remember speaking with a 74-year-old patient named Thomas. Thomas thought constipation was a sign he should rest more. So he sat down, moved less, and guess what? Everything got worse. When he finally understood that gentle, consistent movement actually helps, everything changed. Here's the science. Movement, especially gentle, regular movement, stimulates your colon. It encourages those muscles we talked about to do their job. You don't need high-intensity exercise. You need consistency. 30 minutes of moderate activity most days of the week. Walking is perfect. Swimming is excellent. Tai Chi or yoga is great. Even gardening counts. The key, regular, gentle movement that you'll actually stick with. What happened next with Thomas was interesting. His family noticed that he had more energy. He wasn't just fixing his constipation. He was becoming more active overall. His grandchildren wanted him to come hiking with them again. Mistake was adding too much, too fast, without the other pillars in place. Here's what actually works. You need the right combination of fiber, fluids, and timing. Think of it like this. Fiber is like a sponge. It absorbs water. But if you don't have enough water to absorb, remember pillar 1, and that sponge just gets dry and hard. That's what was happening to Robert. The right approach, start by establishing good hydration, then gradually, and I mean over several weeks, not days, increase your fiber. Focus on soluble fiber first. Oats, beans, fruits like apples and pears, and vegetables like broccoli. These work with your system instead of against it. Soluble fiber, oats, beans, apples, pears, broccoli. Add fiber gradually over weeks. Eat smaller, regular meals. Prunes and prune juice have natural compounds that help, but again, with plenty of water. Avoid processed foods that lack fiber. One specific thing that helped Margaret, we identified that she did much better with 5 small meals a day instead of 3 larger ones. Smaller meals mean her digestive system could handle them better. Her energy improved too. Remember Susan? Susan discovered something powerful. Her digestive system actually responds to consistency and calm. Your gut has a natural rhythm. When that rhythm is disrupted by stress, by changing meal times, by irregular sleep, everything backed up. Literally backed up. What helped Susan and what can help you is establishing a predictable routine. Eat at roughly the same times each day, sleep and wake at similar times, and give yourself permission to manage stress. Consistent meal times, this is crucial. 7 to 9 hours of sleep nightly, morning routine with time in nature if possible, 10 to 15 minutes of meditation or deep breathing. Even 5 minutes can help your nervous system calm down. What happened next with Susan shows you the power of this. Within 3 weeks, her digestion improved, but something bigger happened too. Her family noticed she seemed more at peace. Her stress was lower. Her whole health improved, not just her digestion. We're almost at the finish line. If these 4 pillars are making sense to you, this is the moment to subscribe and ring that bell. This information is changing lives. Now, I want to be very clear about something. The 4 pillars I've given you work for most people, but there are times when constipation signals something that needs medical attention. Sudden change in bowel habits when it's different from your normal. Severe pain in your abdomen or back. Blood in your stool. Unexplained weight loss. Persistent constipation that doesn't improve within 2 weeks of trying these changes. Signs of dehydration, dizziness, dark urine. These could indicate underlying conditions that need professional assessment. I had a patient once, 71-year-old Henry, who kept ignoring the changes he was noticing. His children finally insisted he go see his doctor. Turned out he had a treatable condition that was contributing to his constipation. Once we addressed that, everything improved. The point? Listen to your body. Listen to your family. Don't assume everything is just normal aging. Also remember what we discussed about medications. This is crucial. If you're on medications that might be slowing your digestion, bring this up with your doctor. There are often alternatives that work just as well without the digestive side effect. Myth versus fact myth. Laxatives are the best solution for constipation. Fact, laxatives can help occasionally, but overusing them actually makes your colon dependent on them. Your muscles get weaker. The 4 pillars address the root cause instead. Myth, you should have a bowel movement every single day. Fact, normal is anywhere from 3 times per week to 3 times per day. What matters is what's normal for you and whether you're having difficulty. Myth, if you're over 60, constipation is just part of life. Fact, it's common, but it's completely manageable. You don't have to accept it. Margaret didn't, Thomas didn't, Susan didn't. Myth, you need to eat more food to fix constipation. Fact, you need to eat the right food at the right times. Quality matters more than quantity. I want to end with something important. When Margaret first came to see me, she didn't just have a digestive problem. She had lost her independence. She'd withdrawn from her family. She was anxious about her future. The constipation wasn't really about the constipation. It was about what it was stealing from her life. What I've learned in 25 years of medicine is that fixing the physical problem often fixes so much more. When Margaret could hike again, it wasn't just about her digestion improving. It was about her confidence, her joy, her sense of independence. The same will be true for you. When you implement these 4 pillars, hydration, movement, smart nutrition, and routine, you're not just improving your digestion, you're taking back your life. You're telling yourself, I'm not accepting a limited life. I'm not letting my body dictate what I can and cannot do. That's powerful, and you deserve that. Here's what I want you to do. Choose 1 pillar. Just 1. This week, focus on that. Next week, add another. In a month, you'll have completely transformed your digestive health. You won't be thinking about constipation anymore. You'll be thinking about your next adventure. Before you go, I have one more ask. Please share this video. Share it with your friends. Share it with your family, because I guarantee you know at least one person dealing with exactly this, and many of them are suffering in silence, thinking it's normal. It's not, and they deserve to know that. Thank you for spending these 20 minutes with me. Subscribe to the channel if you haven't already. We post new health education videos every week, all designed specifically for people like you, seniors who want to live full, independent, joyful lives. In fact, next week we're talking about something that affects your energy and mood. You won't want to miss it. Until then, remember, you're not getting old. You're getting wiser, and you deserve to feel good in your body. Take care.